Okay, welcome back to DC EKG with Joe Grogan and Eric Ueland. We once again are continuing our discussion with Brian Blase, CEO and founder of Paragon Health, and one of the brightest lights in the conservative healthcare movement. So, Brian, you're not tough enough to go more than 2.5 years or so, and you leave the Trump administration. You abandon Virginia and their shut down schools for the sunny climate of Florida, open schools. That, remember, of course, this is during the COVID shutdown when you had left. And you're consulting. You found a new think tank called Paragon Health, which we're going to get to in a minute. But you've had a number of different op-eds posted in the Wall Street Journal since you've left the White House and since you founded Paragon, most recently on something called the family glitch. Now, when we were talking about how the Obama administration implemented the Affordable Care Act, you alluded, not specific, you didn't make this direct accusation, but you alluded to politicization of the IRS and the Treasury Department. So let's talk about this op-ed that you had published in the Wall Street Journal on the family glitch. And what is the family glitch, and why does your face turn red when you think about the family glitch and what the Biden administration did?
So let me start by saying I did leave the White House. It was 2.5 years that I served in that position, and as you know from both of you from serving in those positions, you're working round the clock. And most people in those positions don't last the entire term. I mean, credit to you both for serving as long as you did. I loved the position in the White House, but when the executive order, when we finished implementing all the elements of the executive order, when we did the HRA rule, I was the lead briefer that day for the president. He announced the HRA rule in a Rose Garden ceremony. It was actually on his birthday, June 14th. I was in the front row next to cabinet secretaries. My parents and wife got to attend that. It was really a great capstone to my time in the administration. And I had identified the right person to replace me. And I was confident that he was going to be able to carry on the tri-department health policy process that we had initiated, Joe. And you were still there, and I had confidence in you and Eric, obviously. And it was time for me to spend some more time focused on my family. What really has motivated me in health policy is just enormous frustration with the status quo and how wasteful the system is, and how there's a lot of entities out there that can get really rich from not serving patients and not serving taxpayers well. And sort of 50% of healthcare spending flows through the government, and just the inefficiencies involved with the government allocating resources, figuring out what the prices are going to be, having all these sort of inefficient subsidies. It's maddening. And it really just motivates me to try to expose the problems with government healthcare programs. So the family glitch is an issue that I had been aware of since my days at the House Oversight Committee. I guess probably his way of sort of brief background. Obamacare contains all these subsidies for people to purchase individual market coverage, but they're really expensive. So they had to craft a law and limit the availability of these subsidies. Otherwise, the U.S., the law would have been I think the law was already fiscally irresponsible, but it would have just blown even larger holes in the U.S. deficit. So they limited these subsidies to people who didn't have an offer of either government coverage like Medicare or Medicaid, or didn't have an offer of an affordable employer plan. So what they needed to do was define affordable employer plan, and they defined it with respect to self-only coverage. So what the worker would pay for their coverage. If it exceeded about 10% of their income, that was unaffordable, and the worker could qualify for a subsidy. But the law limited the availability of those subsidies to dependents. So if the self-only coverage was affordable, even if family coverage might not have been less than 10% of premiums, those workers' dependents didn't have access to a premium tax credit. So some people call this the family glitch. There are estimates that there are about 5 million people in the family glitch, although the vast majority of them, over 90% of them, do have coverage. They're dependents who are enrolled in a spouse's or a parent's employer health plan.
But glitch implies that there was a mistake, yet you're saying that this was an intentional choice 12 years ago by the framers of this law, which has persisted ever since.
Correct. So I call it the so-called family glitch for that exact reason. The Obamacare is clear. Treasury and IRS do rulemaking around premium tax credits back in 2012 in the Obama administration. There's a lot of pressure on IRS and Treasury to ignore the law and have a more expansive definition of affordability. But they stay true to the law. They issue a regulation that defines affordability based on self-only coverage, and that's the policy that has been in place for a decade. This White House doesn't like that policy choice. I mean, progressives in general don't like this policy choice, and they have put enormous political pressure on the Internal Revenue Service to come up with a different definition of affordability. I honestly didn't think, from working with the IRS folks, that they would be able to convince IRS to change their position. I don't know how much pressure has been put on. I think part of the issue is there's been a turnover at IRS, and some of the institutional staff there that would have not cowed to this pressure have gone into different positions. But they proposed a rule, I guess earlier this month, that violates the statute and that would spend billions of dollars each year in subsidies beyond what is consistent with the law that Congress passed.
So just one thing on that. I mean, if you look at the way this rule popped out, this proposed rule, President Obama's visiting the White House. It's the first time he's been to the White House since he's left. The budget had just come out the week before. In the budget, they put in what regulations they think they're going to address and how they might address them. They don't necessarily go into a lot of detail, but this is not in the budget. The family glitch, which spends money, even if you agree that it's the right policy, nobody disputes that it spends money. It's not in the budget. So having worked at OMB, which manages the budget process, I'm wondering if OMB had signed off on it either, certainly in that process. And then the Biden administration, they need something to announce when Obama shows up. And they're like, we got to hustle on the family glitch. And they put a lot of pressure on IRS and get this thing punched out. It'll be interesting to see at some point some of these emails and meeting notes are going to come out, I think. But I would agree with you. Do you think this is going to be this is going to be the subject of a lawsuit?
So I do. So the process is there's a 60-day comment period. And I mean, most of the comments are going to be supportive because they're going to be from industries and interest groups that want more government subsidies for healthcare. But I know there's going to be some comment letters that tell the IRS this is inconsistent with the law.
You might know of one in particular, perhaps?
I will definitely be making a comment letter. I mean, I already have the Wall Street Journal piece on this, but I think it is the IRS should not be politicized. Like, they enforce the tax code. You cannot have a new presidential administration coming in and saying, we would like you to enforce the tax code in a way that meets our political interests. Like, think about the long-term negative ramifications.
Not collecting capital gains tax, for instance. The Republican administration might say, don't give everybody a tax cut and just interpret the law differently than the plain reading says. Now, I don't want to out the individual, but you did tell just an interesting anecdote that a career employee had called you after your piece appeared in the Wall Street Journal and said what?
Said that I was spot on.
So somebody working a civil servant within the federal government gave you a call and said, you're right about this.
Yes. Somebody who has experience working in that policy process, and so I took that as very encouraging. And Congress needs to investigate this. They need to get the documents and communications and figure out who in the White House was putting pressure on IRS and Treasury officials, and how this decision got reversed.
So this is great right now. So Biden administration is now moving regulations, irritating Brian Blase. As I've said, you have founded a think tank about a year after you left the White House. When did you get up and running?
2 years.
So in full disclosure, I'm on the board of this think tank. I will say this: the board is not always informed about what you're up to, Brian. And Eric,
you need to read your emails, Joe, because I am informed.
Touche.
I too am a board member. With that having been said, tell us a little bit about what motivated you to found this, and then what you're driving to with Paragon here over the next few years.
Yeah, I think it's health policy is the most important domestic policy priority. Like, we're coming up to 20% of the economy. Government health care programs are unsustainable. They're the reason why we have such huge budget deficits right now, with the baby boomers aging and healthcare costs continuing to rise. Right, this is where the main source of fiscal pressure on the federal budget is, and it's obviously crowding out family budgets too. And we're not getting any healthier. Right, American life expectancy. So we get Obamacare, we get all this new federal spending. American life expectancy lower in 2019, 6 years after Obamacare starts, than it was in 2013. So we've got
and
all
that's
these
before COVID hit.
Before
right,
COVID,
exactly.
Yes, before COVID. It's obviously plunged even further with respect to COVID, and the conservative, free market, libertarian side of the sort of policy debate is just overwhelmed by the left. So they just, on health policy, they just have more expertise. And I wanted to counteract that. So to develop proposals, develop research, to be able to do critical evaluations of government programs, because it's not the intentions behind government programs that matter, right? And many of these government programs have great intentions, but they don't work, right? They're inefficient. They, in some cases, actually are worsening our health. We should do evaluations of how these government programs are failing. And have a set of proposals to go that are consistent with our principles.
Well, why didn't you go just to work for one of the establishment think tanks, the established
the ones that you've been at before and done such great work at?
You were at Mercatus. There's the American Enterprise Institute,
Heritage
Foundation,
Grandfather,
Cato. Your phone must have been ringing off the hook when you left, and people understood that all the great policy work that you had done. You would have had other opportunities besides just
there's something attractive about being your own boss.
Artfully done.
Joe, you're not familiar with that, are you?
So those organizations, and they have great folks that work on health policy, but they have a much broader set of issues. And I think we wanted to be efficient and avoid a lot of the bureaucracy that comes with larger organizations, so that we can sort of cut through that. And one of my work philosophies has been to not ask permission, but to ask forgiveness. And just be really aggressive and active, and for the vast majority of the cases that has worked out.
So you found the new tell people about Paragon. It's healthcare, but what? I mean, one thing that's a little bit different is you're in Florida, and you've got thinkers from the right in healthcare policy all over the country. So this is maybe something that wouldn't have been able to be set up. You might have had more skepticism pre-COVID before everybody moved to Zoom. But what makes it different? What's your defining philosophy? What animates Paragon? What are you up to?
So it's really the people that we have in the leadership positions at Paragon, and the advisors that we have for Paragon are individuals that have deep policy expertise, but have also served in government and know how the process works and know how to implement change. So I have Paragon organized into, at the federal level, 4 initiatives, and then we've got a state health reform project as well. But each of our initiative directors has significant experience in their policy area. So just to take one, I mean, our friend Demetrius Kouzoukas, he ran the Medicare program for all 4 years of the Trump administration. He served in HHS, in the General Counsel office, in the Bush administration. He understands Medicare policy at a very deep level. He is, very principled in his approach to health policy, but he also knows the bureaucracy and how the bureaucracy works and how to move reform through the bureaucracy. So we've got folks like Demetrius who are helping sort of to craft a policy agenda that is going to be practical, that is going to be able to be implemented. Because we need to start winning battles at the margin instead of always playing defense. We need to think. We aspirationally we know where we want to go, but what are the steps and what are the reforms we're going to make in order to get there? So to focus obviously at the high level on where we want the healthcare system to go, but also where we have policies and regulations where we're ready to move.
So ultimately, a game plan, a playbook for when Republicans recapture the White House and are running the administration again. Are you doing that same sort of playbook work on the state level for the state initiative too?
Yeah, and we're obviously nonpartisan. So if Democrats want to adopt some of our proposals, like building on the HRA rule, we'd welcome working with Democrats as well on ways to increase choice and competition.
Phone ringing off the hook from Democrats yet?
Not yet.
That hope springs eternal, huh?
Yes. And at the state level, they're given the challenges at the federal level, I think, right now, Eric, and also the importance of states in health policy. Our first product was a state health reform book titled "Don't Wait for Washington: How States Can Reform Healthcare Today," and it's got a set of policies that states can implement to expand coverage options and to sort of better enable providers, doctors, nurses to best meet patient needs.
Great. Look, I think one of the most salutary lessons of the first Trump administration in health policy truly was breaking this idea that the fight should only be about coverage, that it really needs to be about care, quality of care, expanding access, growing options, and giving patients and families the ability to make choices inside a framework that allowed for support for them when it came to their healthcare challenges. And that's something that hopefully won't have been lost, courtesy of Paragon and others, by the time Republicans are back in charge of the executive branch and or running Congress here as early as next year.
So before we wrap up, one last question, Brian. You're generally an optimistic person. You've been in tough spots before. Are you optimistic about the direction of healthcare policy? Earlier in the conversation, you made a reference to the Medicare Trust Fund, which is going to start to be insolvent in a couple of years. How long do you think it'll take before we start to see real change in healthcare in the direction that you want to take it?
Yeah, I mean, I think there's certainly reasons to be optimistic, right? There's a lot. The American ingenuity is still there, and the development of the vaccines in sort of record time was a great credit to sort of the public-private partnership that happened in 2020. And we've got innovative products, innovative medications coming on that really improve Americans' health. I think there's reasons to be pessimistic too. I mean, the fact that our life expectancy has been declining prior to COVID is raises alarms. The fact that these government programs just keep getting bigger with more enrollees. We've got now almost 1 in 4 Americans on Medicaid. Medicaid is supposed to be a welfare program for vulnerable individuals in our society. To have 25% of Americans on Medicaid and all the sort of perversities and distortions that come out of that is a real problem.
And
so
over half the births in the United States are the
it's
mothers
close
on
to a
Medicaid.
half, yeah. Yeah. So it's so I think there's reasons to be concerned too, and most of the concern, in my view, is because government programs and government policies are failing, and we need to reverse those those bad incentives that those programs have created.
Well, great. Thanks so much for the opportunity to quiz you, Brian. It's always good to see you. Eric, thank you.
Thank
And
you,
we look
Joe.
forward to
Thank you,
having you
Brian.
back, Brian.
Anytime.